The DRC was built on a field of dreams. The local community and leadership here thought, let's have a research wing if we're breaking ground. And they offered me the position of the founding director. I gladly took it and said, well, we're going to set this up then for cancer immunotherapy. Starting around 2014, of being able to actually build our clean room so that we could start manufacturing CAR T cells for clinical trials. And here we are now, one of the top centers in Canada. CAR T cells are a revolution in oncology. It's been revolutionary against certain blood cancers, but it's a very expensive therapy and access has been difficult for a lot of patients. We developed this manufacturing and delivery consortium that allowed us to start making CAR T cells right here at BC Cancer in Victoria. And we've produced a CAR T product that is as good as the commercial products that are out there, but a lot more affordable and therefore a lot more accessible to patients.
So what that means is a patient comes in for a clinical trial and we can isolate all the immune cells from that individual from a big blood draw. In there, we can take out the white blood cells and we can modify them in the lab and give them new properties that allow them to fight that disease better. This treatment has worked fantastic in hematological malignancies, so that's blood cancers, leukemias, and lymphomas. But where the field is really struggling right now is translating this into that solid cancer space. Luckily, we have some really kind of new cutting-edge preclinical data that's showing us that we've designed new versions of these engineered cell therapies that are able to tackle some of the hardest to treat solid cancers. So we're excited that we're hopefully going to be launching trials to treat ovarian cancer and pancreatic cancer in the coming years with some of these new cell therapies that we've developed.
We've had a number of milestones. For sure, the flagship program is the CAR T cell program, the clinical trials we're actually doing. But that's all backed up by a lot of really deep science that we're doing as well. We've really led the way, my colleague Julian Lum, in looking at the whole metabolism side of that, how tumors and the immune system compete for essential nutrients, right down even to fighting over oxygen.
I study how metabolism alters the function of immune cells with the goal of using genetic engineering to improve the function of those cells that actually go out, seek the cancer, and destroy them. And at the time, in 2008, that was still very much a dream and an idea. But today, it's reality. It's something that we're doing here in Victoria.
When you donate to BC Cancer, you know these are leading to actual new clinical responses in individuals. And the unique thing here is that BC Cancer is leading the field in these types of immunotherapies in Canada.
I'm just so honored and excited to be the first Linda and Marie Farmer Immunotherapy Research Chair. It's a huge honor and it's just an amazing opportunity. Just really shows the commitment, not only of the farmers, but of the BC Cancer Foundation and BC Cancer itself, a commitment to immunotherapy research. You've not only helped us build a world-class research team, but you've helped countless patients involved in our clinical trials and the potential for future patients as we really learn to unlock the power of immunotherapy. The donor dollars that we're raising now are going towards a number of things. We have 2 open clinical trials that we're wanting to complete, and those really rely on philanthropy. We've got a 3rd trial that we want to open as soon as possible, which is CAR T cell for treating solid tumors.
Every time money is raised, it gives hope.
So from the bottom of my heart and on behalf of my entire team, thank you.